the pathogenic one, the pathogenic staph, the big boss. And the big boss is whom? The big boss is staph, Staph aureus, Staphylococcus aureus. Okay. And the Staphylococcus aureus, as we know, it's a gram-positive cocci. It is catalase and oxidase reactions are performed up, and it is found to be catalase positive but oxidase negative. Which one? Staph aureus. Fine. So it's a gram positive cocci, catalase positive, oxidase negative. Besides that, what other important things are there in this? That it's a gram positive cocci. So it will look like in the gram staining which color, guys? In the gram staining, it will look like, okay, in the gram staining, it would look like which color? Purplish violet. Okay. And it will look like a grape-like clusters. Grape-like clusters is the characteristic feature of this particular one. And obviously, which color grapes are these? Violet color grapes are these. Okay. So one thing is that the Staphylococcus aureus is mainly in the form of what? Grape-like clusters. One point. Second point here is regarding the virulence factors. If we talk about now regarding the virulence factors of this particular Staph aureus, that why the Staph aureus is so important. Why does it cause so many diseases? So answer to this particular stuff is the first one, thickness of the peptidoglycan layer. The thickness of the peptidoglycan layer. Okay, you know that it is a gram positive bacteria, and obviously this particular one is thick in the case of gram positive, and this acts as a virulence factor for the Staph aureus. So thickness is peptidoglycan layer is one of the virulence factors of Staph aureus. Second one is a particular substance which is present in the cell wall of the Staph aureus termed as teichoic acid. So teichoic acid as such is a feature of all the gram positive cell wall. And how you remember that? Remember that again like a upside association. And what is that upside association? Positive. Those particular fellows which are positive, they stays in the life. Means टिकते हैं. In Hindi what could say? टिकते, persist. If you are positive in life, then you persist. Okay. So there is no use of being negative in life. Okay. In any sort of upset situation also, deep within, be positive. Then only you will survive in the struggle of the life. So that is what is termed as teichoic acid. So टिकते हैं. टिकते means persist करते हैं. So gram positive cell walls, what they have are teichoic acid. So this also helps this bacteria to survive. टिकने में help करता है. Okay. The third one is the clumping factor. The third one is what, guys? The clumping factor. As the name suggests, it helps in clumping factor. And this clumping factor is actually the bound coagulase. This clumping factor is actually the bound coagulase. Bound means in the cell wall it's a bound form. So clumping factor, I've already told you, coagulase is the one which is the best test to determine the pathogenicity. So obviously, it also contributes to the virulence of the Staph aureus. The fourth one is important, and the fourth one you must be knowing also, that is the protein A. Okay, the protein A, and this particular protein A which we have talked about, this particular protein A which is there, it is not present in everywhere. This is present in CoV1 strain of Staph aureus. It is present in this special strain of Staph aureus. Which one? CoV1 strain of Staph aureus. And suppose this is Staph aureus and it is having over its surface what? Protein A, which is a extra factor here in the virulence. And this protein A have a wonderful role. And what is that role? It binds to the Fc fragment of IgG. And if you have done your pathology, then must be knowing up the Fc fragment of IgG is a opsonizer. It's a opsonizer. So it binds to this opsonizer, neutralize it, and thereby avoid what, guys? It avoid opsonization. Okay, thereby avoid what? opsonization. And if it avoid opsonization, obviously it will avoid what? Phagocytosis. It will avoid what? Phagocytosis. So this particular protein A helps this organism in avoiding the opsonization and thereby avoiding the phagocytosis. And as you know that the humans are the best scientists. So what they have used this protein A in, protein A is a virulence factor. That is very clear now. Okay. But they have used it in one of the reactions. And that reaction name is what, guys? That reaction name is co-agglutination. Okay. So protein A is helpful in a reaction also, and the name of the reaction is what, guys? Co-agglutination. As the name suggests, that the Staph aureus is helping some other bacteria to agglutinate, and that's why the term is what? Co-agglutination. Let me tell you an example. Okay. Suppose a particular meningitis patient comes to you and the sample of yours is having CSF. Obviously, in the meningitis, you will take CSF. And in this, you want to find out regarding the meningococcal antigen. You want to find out in the CSF what? The meningococcal antigen. Okay. So now, by knowing up that this particular organism is having a property to bind to the Fc fragment of IgG, protein A. Okay. So what we have with us? We have with us ready-made antibodies. Means we have Fc fragment of IgG of which organism? Meningococcus. Okay, meningococci, I should say. Okay, so these Fc fragment of IgG of the meningococci is ready-made available with us. Okay, ready-made available with us. And what we have done, we have taken the sample of the patient in which what we want to find out, meningococcal antigen. So when you mix up this, they bind up, they agglutinate. Okay, these ready-made ones with this meningococcal antigen, they will agglutinate. But this agglutination is possible because of protein A. And protein A is with whom? Protein A is with Staph aureus. So this Fc fragment of IgG, this one, will be staying off where? Over the protein A, that is which is holding up Staph aureus. Okay, so Staph aureus is holding up this protein A. A protein A is binded thereby to Fc fragment of IgG because they have that property. This property we have used up for which reaction? Co-agglutination. Again, I'm telling up that this particular property of Staph aureus that is holding a protein A and binding to the Fc fragment of IgG is being used in a reaction, and the reaction name is what? Co-agglutination. And what is that particular one? In that, what we have done, that the Fc fragment of IgG, which is there, meningococci ones, we have prepared them in the lab, meningococci ones, and they are bonded to what? Protein A of the Staph aureus. Okay, and you have taken the patient sample. The patient sample is what? CSF. In that, what do you want to find out? Antigen. This antigen will bind to this antibody because this is meningococcal antibody only when the antigen is present. And that's why we say that this procedure is termed as what? Co-agglutination. Why? Because this is happening because of the Staph aureus. If the Staph aureus would not have been here, the protein A would not have been here. And if protein A is not there, obviously this agglutination will not be possible. Fine? Because the Fc fragment of IgG needs something to stabilize, needs something to be over. And that over is protein A. So this is what is termed as co-agglutination. I suppose now it's clear. Okay. Now, the fifth one is what? The fifth one is regarding the hemolysins. Okay, the fifth one is regarding what, guys? It is towards the hemolysins. And the hemolysins, what they can be? The alpha hemolysin, the beta hemolysin, the gamma hemolysin. These are the most important ones. Even delta hemolysin is also there in this particular one. But these are the most important. Alpha hemolysin means which does the alpha hemolysis. And this alpha hemolysis produces a which sort of action? It produces a paradoxical action. It produces an action which is termed as what, guys? Paradoxical action. And what is this paradoxical action? The paradoxical action is this. What is the paradoxical action? It is this, that it inactivates this alpha hemolysin activity, inactivates at 70, but reactivates at 100. Okay, it reactivates at 100 degrees centigrade, and this particular property of inactivating at 70 and reactivating at 100, isn't it a paradox? So this is what is termed as paradoxical action. This is what is termed as paradoxical action. It inactivates at 70 but reactivates at 100 degrees centigrade. And which particular fellow shows it? Alpha hemolysin. Then comes the beta hemolysin, and beta hemolysin shows up a phenomena termed as hot and cold phenomenon. It shows up a phenomenon termed as what? Hot and cold phenomenon. And what is hot and cold phenomenon? So obviously, you know, beta hemolysis is what? A complete hemolysis. Okay, so this beta hemolysis starts. This beta hemolysis, this complete hemolysis starts at which temperature? It starts at 37 degrees centigrade, but best seen at, it is best seen at 4 degrees centigrade. It is best seen at which temperature? 4 degree, which is the cold temperature, which is the cold temperature. And this one starts at which one? 37. This one starts at which one? 37 degrees centigrade. You got my point? And this is what is termed as hot and cold phenomena. This is what is termed as what? Hot and cold phenomena. Means this beta hemolysis, which hemolysis? Complete hemolysis starts at which temperature? 37, but best seen at which temperature? 4 degrees centigrade. And this is what is termed as hot and cold phenomena, shown by which fellow? Beta hemolysin. Fine. Then comes the gamma. Gamma means no hemolysis. Only thing to be remembered regarding gamma is which I am going to tell you. Now the sixth one is a particular stuff termed as penton valentine toxin. Okay, penton valentine toxin. And this penton valentine toxin is also termed as leukocidin. That is also termed as what, guys? Leukocidin means which kill the leukocytes. Okay, which kill the leukocytes. Which kill the leukocytes. That is what is termed as penton valentine toxin. And here I like to tell you one thing, that this particular gamma hemolysin, which we have just seen, gamma hemolysin with this penton valentine toxin, okay, with this penton valentine toxin, they show off a particular action, and that action is termed as what? Synergo hypnotropic action. Synergo hypnotropic action. And what is that synergo hypnotropic action? That is combination of them. In synergy, they increase, this particular one increase the virulence of the bacteria. That is the Staph aureus. Virulence of the bacteria, that is the Staph aureus, is being increased up by this combination of gamma hemolysin with penton valentine toxin. Is it fine, guys? So this you need to know first of all. Then, other than that, the seventh one is regarding the various enzymes. The various enzymes are there which acts as a virulence factor. And what are those enzymes? So they are like hyaluronidase, okay, lipase, and phospholipase. That is also there. Okay, DNase, thermonuclease, and there is no doubt which is the main one? Coagulase. Which is the main one? Coagulase. So these are the various enzymes which are of the Staph aureus, and they contribute to the virulence of them. And the main one, no doubt, is what? Coagulase. On the basis of what we have? Coagulase test. Is it fine, guys? So this particular one is the main virulence factor of the Staph aureus. So in total, these all 7 you need to know regarding the virulence factor of Staph aureus. What all 7? Let's see once again. The first one is the thickness of the peptidoglycan layer. Okay, as it is the gram-positive bacteria, the thick peptidoglycan layer is a feature of it. The second one is the teichoic acid. The third one is the clumping factor, which produces clumps. Then the most important one, that is the protein A, which have a property to bind to the Fc fragment of IgG, and this property is being used up in a reaction termed as co-agglutination. Fine. Then this particular one, hemolysins, which hemolyze the RBCs. Alpha hemolysin shows up a paradoxical action. Beta hemolysin shows up hot and cold phenomena. And let me tell you one important thing, that how to remember this beta hemolysin hot and cold. Remember like this: born beta, hot and cold. That is beta hemolysin hot and cold phenomena. Okay. Then comes the gamma one, and the gamma one, there's no hemolysis. The only thing which you need to know regarding gamma is that when it mixes up with the penton valentine toxin, which is the leukocidin, it shows up as synergy. And that action is termed as what? Synergohymnotropic action. That action is termed as what? Synergohymnotropic action. And this one increase the virulence of the bacteria. Which bacteria? Obviously Staph aureus. Then the various enzymes like hyaluronidase, lipase, phospholipase, DNase, thermonuclease, and even coagulase. These are the ones which primarily involves in the virulence of the bacteria. And in them also, if somebody asks the most important enzyme, no doubt that is coagulase. Because of that, the Staph aureus is having what? Pathogenicity. Because of that only, the Staph aureus is having what? Pathogenicity mainly. Is it fine? So these are the various virulence factors which governs the Staph aureus. Okay. Now after the virulence factors, we'll focus upon the various toxin mediated illness done by Staph aureus. So guys, can you tell me what are the various toxin mediated illness of Staph aureus? So the first and the most important is food poisoning. The first and the most important is what, guys? Food poisoning. That suppose you have gone to a marriage party and there you had some paneer, tasty paneer, but after that 1 to 6 hours after having that paneer, you landed up in the hospital. Okay, because that was a contaminated paneer, not kept properly, and some toxins is being prepared in that. And obviously they will say that we have properly roasted and everything we have done before giving you, but still it will happen because there's a heat stable antirotoxin. So guys, the food poisoning of Staph aureus, the first question which is being asked is the incubation period of it. What is the incubation period of Staph aureus food poisoning? The answer is 1 to 6 hours. First thing. Okay, what is the incubation period? 1 to 6 hours. Then the same incubation period, this particular one mimics up the incubation period of which other guy? That mimics the incubation period of Bacillus cereus. Okay, this particular one mimics up the incubation period of what? Bacillus cereus. Which particular strain? Ematic strain. Which particular strain? Ematic strain. Emesis, like vomiting. That one is there. It mimics that. Because the incubation period of this also is what? 1 to 6 hours. But now you tell me, if the both the patients comes to you, then how you differentiate that this is by Staph aureus or Bacillus cereus? The only thing which you have is history, what you have eaten up. In this, the person will say contaminated meat or any sort of milk product. That history will be there. And in this, there will be what? Contaminated Chinese fried rice. Okay. Contaminated Chinese fried rice. And obviously, it is which sort of a rice? Reheated Chinese fried rice. Okay. Reheated Chinese fried rice is the causative stuff for the Bacillus cereus hematic one, that somebody have eaten up this, and the contaminated meat and milk is for the Staph aureus. First of all, this thing. This is regarding the incubation period. After this incubation period, the second most important thing is that which antirotoxin is there. The answer is antirotoxin A. As such, they are from A to I. Number of them are there. Remember the most important one, antirotoxin A, which is the most common. You no need to remember everything. Enterotoxin A is the maximum, that is most common. This one is a heat stable enterotoxin. Remember, this particular toxin is what? It is heat stable, enterotoxin A, and it is termed as preformed. Preformed means it is already in the food, okay, already being there, and it doesn't change up to any other form inside the body. So that is termed as what, guys? Preformed. So it's a preformed toxin, heat stable toxin, and enterotoxin A is the name of it. And what is the action? The action is vagomimetic action. What is the action? The vagomimetic action. And what is vagomimetic? It stimulates the vagus. It stimulates the vagus. That is the action of the Staph aureus enterotoxin, most commonly A. Every line right from above up till last is being asked as a question. Okay, every line of it right from the incubation period up till last is being asked as a question. So you should know every nook and corner of this particular question. Is it fine? So this is done regarding the food poisoning. After that, if we talk about what? We talk about the double S, double S. Okay, double S, double S. And what is double S, double S, guys? The double S is staphylococcal skin scalded syndrome. Staphylococcal skin scalded syndrome, that is termed as double S, double S. As the name only suggesting, skin scalding is there. The skin removal is there in this particular double S, double S. And it is due to the enterotoxin A and B. It is due to what? The enterotoxin A and B, also termed as exfoliative toxin. It is also termed as what? Exfoliative toxin A and B. Exfoliative toxin A and B or enterotoxin A and B, they are the same thing. Is it fine? And they act upon a particular thing termed as desmoglein 1, that is in the stratum granulosum, desmoglein 1, and because of that this scalding happens. Okay, so this name desmoglein 1 you should know, and it is present in the stratum granulosum, and this leads to the scalding. And which one is involved? This exfoliative toxin A and B. This ailment is termed as Reiter's disease. This particular ailment is termed as which disease in the children? Reiter's disease in children. And it is being said, it is also termed as toxic epidermolytic necrolysis. Okay, this is also termed as what? Toxic epidermolytic necrolysis. In short, you can call it as 10. And this 10 happens to be in adults, but definitely this is controversial. Okay, definitely it is controversial. Reiter's disease is fine, but 10, some they doubt that it is being done by Staph aureus or not. Okay, but still you should know that in the adults it is termed as what? 10, toxic epidermolytic necrolysis. So this is one of the things. Besides that, guys, the third most important one is TSS. Okay, TSS is what? That is toxic shock syndrome. And this particular toxic shock syndrome is being done by what, guys? TSST1. This is being done by what? This is being done by TSST1. So TSST1, which is there in this particular one, toxic shock syndrome toxin 1, also termed as enterotoxin F. This is also termed as what, guys? Enterotoxin F. And this particular enterotoxin F or TSST1, which is there, is responsible for this particular syndrome that is termed as toxic shock syndrome. And the most important thing regarding it is that it is the super antigen of Staph aureus. Now, what is super antigen? Super antigen is that antigen which is binding to the TCR laterally, not in the cleft. Means a super antigen comes and binds to the TCR Not here. It binds here into the lateral side, and that lateral side is termed as what, guys? The lateral side of TCR. Okay, lateral side is which one? V beta. We call it as what? V beta domain. And what is V beta? V beta is variable beta. V beta is variable beta domain. It attaches to the TCR, T cell receptor, V beta domain laterally. And what happens because of this? Because of this action, more than 20% T lymphocytes of the body, they get activated. Okay. In a normal antigen, what happens? Hardly 1 to 2% they activate. And here it is more than 20% which is being activated. And that particular one leads to what? Massive lymphokine release. Okay, that leads to what? That leads to massive lymphokine release. And this particular massive lymphokine release lands the individual into what? Shock. Okay, and that's why it is termed as what? Toxic shock syndrome. Now, this particular question might come in your mind that this toxin comes from where? So, this particular toxin comes from usage of contaminated vaginal tampons. Okay, this particular ailment said to be strongly associated with what? Contaminated vaginal tampons in menses. Okay, and this used to be before very common, but now very uncommon. So that's what we say, that this particular one is not common nowadays, but still you should know that which is the super antigen of the Staph aureus. The answer is TSST1 toxin behaves like a super antigen and thereby leads to what? This toxic shock syndrome in these particular females who have used of what? Contaminated vaginal tampons. Okay. Then in this shock, the hypertension happens. So obviously, what you will give? IV fluids. And along with this IV fluids, what you will give? You will give the clindamycin. Okay. Important is that clindamycin does not have a antibiotic action here. It have a antitoxin action. It have a which sort of action? It have a antitoxin action rather than the antibiotic effect. So this also is to be remembered in this toxic shock syndrome. So these three are there for now, which are the toxin mediated illnesses of the Staph aureus. So which all are these? The first one is food poisoning one, the second one is double S, and the third one is toxic shock syndrome. Okay. Now, other than that, which all other diseases are being done by Staph aureus? Which all other diseases are being done by Staph aureus? So right from the skin, in them it can cause what? Cellulitis. Okay. Impetigo. Now the question comes, impetigo which one? Bullous or non-bullous? So answer is bullous. How to remember? It is a grape-like clusters, staph. So it produces bulla-like structures. So bullous impetigo is done by staph and non-bullous is done by this particular one, that is Streptococcus pyogenes. Is it fine? So cellulitis, impetigo, certain other pus ones like carbuncles, furuncles, churuncles, all sorts of uncles, they are done by Staph aureus. So remember, these all are what? Pyogenic stuffs. Besides all this, the important one which you should know is, which is being asked twice or thrice, is butyriomycosis. Okay. And why it is asked, guys? Butyriomycosis? Because what is coming in the name? Mycosis. And that means it's done by a fungus. But this is not true. This is not done by a fungus. It is done by a bacteria. And what is the name of the bacteria? Staph aureus. Okay. So remember, Staph aureus does this butyriomycosis, which looks like a mycetoma-like lesion. Okay, mycetoma-like lesion, and this is a frequently asked question. This is a frequently asked question. Which one? Butyriomycosis. Remember, mycosis is there, but it is done by what? Staph aureus, because the granules which you have in this, when you do the gram stain of that, in that you can see grape-like clusters as a Staph aureus. So this is very clear that this is done by staph, not by the other ones like fungus or any other bacteria. Is it fine? So this is there. Other than that, it associates with acute mastitis. Okay, in a lactating female, it can do what? Acute mastitis, and thereby leads to what? Breast abscess. So the cause of breast abscess is also what? Staph aureus. Then it can involve the joints and leads to what? Septic arthritis. It can involve the joints and leads to what? Septic arthritis. One of the common causes of acute osteomyelitis. Another thing with the bone, acute osteomyelitis. Is it fine? So septic arthritis and acute osteomyelitis, that is being also done by the Staph aureus. Is it fine? Now, besides all this, this one associates with post-op parotitis. This also associates with what? Post-op parotitis, that is post-operative parotitis. This one also associates. Okay. Other than this, what all we have, guys? Other than this, what else is being done by this particular Staph aureus? The important one is it associates with bronchopneumonia also. It associates with bronchopneumonia also, and it is one of the common causes of what? Nematoceles. Okay, it is one of the common causes of what? Nematoceles. This is the, in fact, most common cause of nematoceles is Staph aureus. Then subdural or epidural abscess. This is also being done by Staph. This also being done by what? Staph aureus. Now, the most important thing is that this associates with native valve endocarditis. This associates with what? This associates with native valve endocarditis. That is, the original valve is being damaged by Staph aureus, and this is also termed as ABE. And what is ABE? Acute bacterial endocarditis. Other than that, what you need to know here is, in the IV drug abusers, right-sided valve endocarditis, right-sided valve endocarditis, that is also being done by whom? Staph aureus. And here only I like to tell you, if they do not mention right or left and all, and they just write up IV drug abusers, again the answer is what? Staph aureus. Again the answer is what, guys? Staph aureus. So remember that particular fact also. So whenever you hear about IV drug abuser, immediately what should come in your mind? Staph aureus. Okay, that should come in your mind. That is the Staph aureus. Now, besides this, this particular one also associates with tropical pyomyositis. Okay, this also associates with what? Tropical pyomyositis. Pyo means pus, myo means muscles, inflamed. So that is termed as tropical pyomyositis. So all these particular ones, they are being done by what? They are being done by Staph aureus. Is it fine? And I think the every particular thing is being asked because Staph aureus is definitely important. Okay, it is definitely important. So that also he needs to remember. And for your help, I like to tell up that there is a mnemonic which can help you to remember all these ailments at one go, and that is the soft pains. Okay, and what is there in the soft pain, guys? Septic arthritis. Just now I told you, one of the common causes of what? Septic arthritis, and it does one of the common causes of what? Osteomyelitis also. And here I like to tell you one thing, that as such it does osteomyelitis, no doubt, most common cause, but in sickle cell anemic patients. But in sickle cell anemic patients, if somebody asks you that which particular organism associates with osteomyelitis, the answer is Salmonella. Okay, the answer is what? Salmonella. How to remember? You have to make up Salman. Okay, just for the remembrance sake, I'm telling up. Don't get, if you're a die-hard fan, don't get offended by that. And just for the remembrance sake, Salmonella have got, Salman have got what? Sickle cell anemic anemia by chance and developed osteomyelitis. So if you like absurdly associate like this now, you will remember this particular fact for sure. And now you try also. That Salman have which particular disease? Sickle cell anemia. And in that developed what? Osteomyelitis after some accident all developed this particular osteomyelitis. Damage happened. F is what? F is furuncles. I just told na furuncles, churuncles, all sorts of uncles. They are done by what? Staph aureus. T is toxic epidermolytic necrolysis. That is termed as 10. Toxic epidermolytic necrolysis. That is termed as what? 10. Then P is what? Nematoceles and pneumonia. One of the common causes of nematoceles is Staph aureus, and it also associates with bronchopneumonia. Then regarding the abscess, if I talk about, obviously we have done that it associates with which particular abscess? Breast abscess. In which conditions? Acute mastitis stuff. Okay. I is what? Infective endocarditis. Infective endocarditis. One of the common causes of infective endocarditis is Staph aureus. And in fact, we should remember native valve endocarditis is being done by this particular Staph aureus. And native means what? Original valve is being damaged by this Staph aureus. S is what? That is the shock syndrome. Which shock syndrome? Toxic shock syndrome. Toxic shock syndrome. So if you remember up this particular stuff, soft pains, at least something you will able to recall up in the exam. And other than that, what is the most important which I told up? Butyriomycosis. Mycetoma-like lesion, which is not done by any fungus. It is done by what? This particular bacteria. Okay. So if you remember this much, you will able to recall up much other diseases of Staph aureus. Fine. Now after these diseases, let's talk about the treatment part. And the Staphylococcus, you know, what is the treatment of choice? Our answer is penicillin. And regarding this, you already know the Staph and Strepto, they are treated by what? Penicillin. But remember, there are certain things which are termed as like MRSA or VRSA. Okay. So if somebody asks you that what is the main factor which makes a simple Staph aureus MRSA, then you should know that there is production of PBP2A stuff. Okay. You know na that every particular bacteria is having what over its cell wall? Penicillin binding proteins, which are also termed as transpeptidase. So that transpeptidase or penicillin binding protein changes to what? Penicillin binding protein 2A. Okay, and how they manage to change this? Because of a gene. They have acquired this particular gene from somewhere, and name of the gene is what? MAC-A gene. What is the name of the gene? Answer is MAC-A gene. Okay. Besides this particular MAC-A gene, which changes from PBP to PBP2A, there is production of beta lactamases. Okay, there is production of certain enzymes termed as beta lactamases, which acts on the beta lactam ring and contributes in making a simple Staph aureus MRSA. Okay, one thing is for sure. Now, telling up the story behind it is that these particular ones, PBP, to which the penicillin group comes and attaches and inhibit the cell wall synthesis, is being changed up into what? PBP2A. Now the penicillin group comes, it could not able to find the sites only to attach, and that's why it could not able to kill that particular organism. And this is the story. This is the main factor, number one factor, which makes a simple Staph aureus what? MRSA. Okay. And the second one is what, guys? Production of beta lactamases, and in them special enzymes like penicillinases also, they are being produced by this particular Staph aureus in becoming from Staph aureus MRSA. Is it fine? So one of the things is that. Besides that, what else you need to remember here, guys? What else needs to remember? Remember this particular one, that how to go for the lab diagnosis of MRSA. For going up to the lab diagnosis of MRSA, you have a particular thing that is termed as antibiotic testing. And which particular antibiotic testing? Cefoxitin screening test. Okay, cefoxitin screening test, or you can say oxacillin screening test. Okay, cefoxitin screening test or oxacillin screening test. These two are antibiotic testing. And obviously, they are also being done by the same method like Kirby Boyer and all. And it is being done on which particular media, MHA or nutrient agar. So that is sorted. Now, in this, certain change is there that you have to add up 4% NaCl into the MHA plate, because this Staph aureus loves sodium chloride. So 4% NaCl you have to add, and you have to incubate these particular plates less than 37, not at 37. And preferably, what is the temperature at which you incubate them? 30 to 35 degrees centigrade. At which temperature incubate them? 30 to 35 degree centigrade. So that is also there in this particular one. So cefoxidin screening test or oxacillin screening test, these are there. And out of them, if somebody asks you, yes, can you tell me cefoxidin is better or oxacillin is better? So obviously the answer is what, guys? Cefoxidin. Cefoxidin screening test is better than the oxacillin screening test. Why? Because it is being seen that if oxacillin is coming resistant and if cefoxidin is coming resistant, in this regard, you are 100% with the MRSA. It is being said that if in the antibiotic testing, this particular antibiotic is coming resistant, that means you're dealing with what? 100% MRSA. Whereas oxacillin is coming resistant, this particular one, oxacillin is coming resistant, then you are dealing with what? That is 95% chance is there that you're dealing with the MRSA. So this is one of the things which you need to remember. Then after that, which other test you can do? The PCR. PCR for the MAC-A gene is very much available. And other than that, you go for latex card test, okay, for PBP2A. This is also available nowadays. If all the 4 options are there and they ask which is the best, then the answer is at the genetic level, PCR for sure. Otherwise, out of these cefoxidin, oxacillin, cefoxidin is a better test. 100%. This is not an absolute 100%. This is a relative 100%. That's why I'm not saying that this is the best. The best is at the gene level. If you're able to find out the MAC-A gene in the PCR, your work is done. You are dealing with the MRSA. Is it fine? So this is also one of the points which you should know. Okay. Now, besides that, if somebody asks you that what is the drug of choice for MRSA, the drug of choice for MRSA is vancomycin. Okay. And which particular syndrome associates with this vancomycin? So answer is, with this, a syndrome attaches, and the name of the syndrome is what? Redmond syndrome. And why this? The person becomes red in this particular one? Because of the histamine release. And that's why we say that whenever you are giving the vancomycin, you should always give before that antihistaminics so that the person does not become red. So this is what is termed as Redmond syndrome. Redmond syndrome. Okay. And we heard of MRSA up till, but now this also have come in the market. And what is that? Varsha. Vancomycin resistant Staph aureus. And this Varsha will discuss up when we'll discuss the Enterococcus, because it is a gift from the VRE only to the Staph aureus. Which particular gene the VRE have given up? VAN gene. Now you must be thinking, what is VRE? Vancomycin resistant Enterococcus. Vancomycin resistant Enterococcus is VRE, and it have given up this particular VAN gene, and thereby it changes to what? VRSA. That is vancomycin resistant Staph aureus. Is it fine, guys? So this is also one of the things by which now it have become VRSA. And what is the drug of choice for this, guys? The answer is daptomycin. The answer is daptomycin or linezolid. Okay. So this is also one of the important points. Other than that, this question came that what is the best way to avoid nosocomial spread in a hospital of MRSA. So this particular one is what? That is the hand washing. Hand washing is the best to avoid the nosocomial spread of MRSA in the hospital. And if somebody is found to be a carrier of what? Staph aureus or MRSA in the nares. Okay, you need to give what? You need to give the mupirocin ointment to that fellow to remove this carrier state. To remove this carrier state. Is it fine? So this is also regarding the extra, like what do you say, nosocomial point, that is hospital based points. Nowadays it is becoming day by day like in the fashion to carry out this nasal swabbing for the healthcare workers whosoever joined in the hospital. Actually what happens is the Staph aureus is a normal commensal in some of the guys. Okay, in fact in 30% of the population in the nares it is a normal commensal. Okay, number of other sites like in the perineal region, in the axillary region, Staph aureus is there in some guys. Okay, so if they are healthcare workers, then how does they become a danger to the patient? This what they want to say. Okay, so that's why you have to regularly manage up the hand washing and all. Okay, hand washing as such seems very like minimal procedure, but this is the most effective procedure to prevent any sort of nosocomial spread in the hospital. Is it fine? So this is also one of the things to be remembered. Coming to the lab diagnosis of the Staph aureus, suppose we'll take it like this. Suppose you have got a swab, or you have got pus, or you have got any sort of a sample from which you need to isolate the stuff. It can be any sort of secretions from the intestine, it can be sputum, it can be any sort of other secretions from the ICU or from the ward. Let's take an example that from the ortho ward you have got the pus. Okay, so how does we go for the, what do you say, that processing? So first of all, when we receive the pus, what we'll do, guys, we will obviously go for the gram staining. Okay, what we'll do, we'll go for the gram staining, and from the gram staining, we will definitely get a hint that we are dealing with a GPC, GNC, that is gram positive cocci, gram negative cocci, or gram positive bacilli, or gram negative bacilli. This can be easily ascertained from the pus gram staining. So you have done that. You got to see that gram positive cocci are seen, and that too violet colored grapes. So violet colored grape like clusters, which are observed in this particular one, they are prominently seen in the gram staining of Staph aureus. And in this particular pus, you might find this because we are dealing with the Staph aureus now. So that's why I've like in this pus, what is seen? Violet color grape-like clusters. Fine. Then after this, you definitely get a hint that you're dealing with Staph aureus. Then you put this pus over the blood agar, or you can put it over the nutrient agar also. This particular pus, you can put it over the blood agar, or you can put it on the nutrient agar also. And what you want to see in that? In the blood agar, you know that it produces which hemolysis the most? Beta hemolysis. Now, what is beta hemolysis? Suppose this is the colony, the complete zone of hemolysis is termed as beta. Whereas in the case of nutrient agar, it produces a beautiful golden yellow pigmentation. What does it produce? It produces a beautiful golden yellow pigmentation on the nutrient agar. And this golden yellow pigmentation which is formed up on nutrient agar looks more beautiful on which media? Milk agar. Okay, it looks more beautiful on which media? Milk agar. What? Golden yellow pigmentation. And this particular one is a non-diffusible pigment. It is which sort of a pigment? It is a non-diffusible pigment, means only the colonies are golden yellow, not the culture media. It does not diffuse into the culture media. Is it fine? So this is there, and you got to see the beta hemolysis of this particular fellow. Now, after that, you want the antibiotic susceptibility testing or sensitivity testing report of this patient, because this is what is needed by the clinician, that which antibiotic I should give. So what you will do, guys, you will pick up the colony from the blood agar plate, you will put it into the broth, okay, peptone broth, mix it, and then put a cotton swab into it, and then take a plate of MHA, And in that particular one, you do the lawn culture. I've told you yesterday also, lawn culture. And in this particular one, lawn culture, you have plated up over it. And in this particular one, now the organism is there over that plate, then you put the antibiotics. And just now we have seen up that all sorts of antibiotics you can put which acts against the gram-positive cocci. And specially you have to put which antibiotic? Cefoxitin. Now tell why. Why you need to put the cefoxitin? Guys, important is this, that if it come resistant, then you should be very much caring about MRSA, that you're dealing with the MRSA. And if it is sensitive, then it's a simple infection. Then on the basis of the antibiotic profile, you can give up that this antibiotic will work best against the Staph aureus. Okay. So this is the way by which you do the processing. Firstly, the gram staining from that presumptive diagnosis. Then they grow up on the culture plate and they grow up in this particular fashion, the typical fashion. Then you get a definite hint that you're dealing with a Staph aureus. And then antibiotic sensitivity testing is done when the MHA. Only condition is that cefoxitin is to be put. It come resistant, MRSA, sensitive, a normal Staph aureus. Now you might say, sir, why we have not used the selective culture media? Because from the gram staining, you already know that you're dealing with a gram-positive cocci, which is grape-like clusters. Most probably that is this. Okay. So guys, if somebody asks you that which is the best selective media for this particular one, the best selective media for the Staph aureus, if somebody asks, is the answer is mannitol salt agar. What is that? Mannitol salt agar. This is the best selective media, mannitol salt agar. And other than that, which other medias are there? Ludlam's media. Ludlam's media. Okay, the one is mannitol salt agar and one is Ludlam's media. The name at least you should know. The best one is mannitol salt agar. And besides that, one more, that is salt milk agar. But obviously, the most important is which one? The best one, that is the mannitol salt agar. Is it fine? Now, this is a pink color media which changes to yellow. It's a pink color media which changes to yellow if what grows over it? The Staph aureus. So remember this particular fact also regarding the best selective media for the Staph aureus. Now, other than that, you already know that this one is catalase as well as coagulase positive. This particular Staph aureus is both these reactions positive. Which one? Catalase positive and coagulase positive. And coagulase is actually the reaction which determines the pathogenicity. In the starting, I have already told you. This particular coagulase is of two types. One is tube coagulase test, which you do on the tube, and one is a slide coagulase test, which you do on the slide. The slide coagulase test determines up the bound form of the coagulase. The bound form of the coagulase means which is in the cell wall. That is being determined by which particular test? The slide coagulase test. And the tube coagulase test determines which form of coagulase? The free form of the coagulase is being determined by which particular one? That is the tube coagulase. Okay, that is the tube coagulase test. It is free. Remember, for the practicals, you get the tube free. Remember like that. Okay, don't tell me the slide also is free. Tube is only free. And the slide is the bound form of coagulase. And how do you do that? You take the slide. Okay, on that you take the normal saline. And in this normal saline, you mix up the colonies of Staph. Okay, you mix up the colonies of the Staph aureus. Obviously, you're doing for Staph aureus only. So normal saline and you mix the colony, you have a milky emulsion. Okay, you have a milky emulsion. And in this milky emulsion, what you add up? You add up the plasma. What you add up? You add the plasma. And after adding the plasma, what you observe, guys? You observe clumps. Okay, what you observe? You observe clumps. And if the clumps they come, that means the slide coagulase test is positive. Slide coagulase test is positive. And once this slide coagulase test is positive, then you do the confirmatory test that is termed as tube coagulase test. And in that also, nothing, the same thing, that you have the broth with you, the bacterial broth. And in that bacterial broth, you add up this particular plasma. Okay, you add a particular plasma into a bacterial broth into the tube, and after like 2 hours, when you tilt up this broth like this, it will be solidified. It will not be coming out. So this is what is the logic which applies up in the tube coagulase, because there is a factor here, coagulase reacting factor CRF, which is free. That has been determined by the tube. And the slide one is regarding what? That is the bond form of the coagulase that is in the cell wall. Okay. So basically don't get much deep into it. Just remember, tube is for free form of coagulase, slide is for bound form of coagulase. Okay. And this is done how? Normal saline you take, NS is normal saline, then colonies of the Staph aureus, obviously, suspected Staph aureus, and then you put up plasma into it. And you observe clumps. This means coagulase test positive. Firstly, this is done, and the confirmation is done by tube coagulase test. Okay. And tube is not in the cell wall, it is a coagulase reacting factor. Okay. That is the coagulase reacting factor, and this is termed as the free form of coagulase. Is it fine? So this way you go for the lab diagnosis of Staph aureus. Is it fine? Besides this, what else you can remember of? Nowadays, it is also being asked in one of the INCIT exam that what is the most common method of resistance transfer in the Staph aureus? The most common method of resistance transfer in the Staph aureus is, answer is what guys? Transduction. Remember, transduction is the most common method of resistance transfer in Staph aureus. And if I remove this particular Staph aureus and just ask you the most common method of resistance transfer overall in the bacteria, the answer is conjugation. What is the answer? The answer is conjugation. Okay, remember this particular fact also. The people, they tend to make it wrong that the most common method of resistance transfer is conjugation, but in the Staph aureus it is transduction, and the transduction is due to what? It is due to a particular virus termed as bacteriophage, and bacteriophage is the one which eats up the bacteria. Okay, and this particular transfer transduction is bacteriophage mediated. This is termed as what? This is termed as bacteriophage or phage mediated. Actually it is phage. This clear? Besides that, here only you should know, and the question also came in the NEET PG regarding the phage typing. So basically, whenever you go for some sort of a nosocomial outbreak in a hospital of Staph aureus, you go for phage typing there. Okay, what you do? You take the samples from every nook and corner of the hospital and send it to the referral center, which is in the MAMC for this particular one. And they have with them 23 types of phages. Okay, means Staph aureus is also having 23 different types of strains which they isolate from different areas. Okay, so 23 types of phages are there in that referral center, and what they will do, like 23 swabs only suppose you put it over the culture plate, the growth will come. Next day you will put what? These phages over it. Fine. And you observe on the very next day what? That when you come to your lab, you see all growths are intact, but a certain growth is absent. Okay, that determines that the hospital outbreak is being done by that particular strain. Why? Because these phages, which are Staph aureus phages strains, they are very specific. They eat up their particular strain only. And what they have found? 23 types, like 40-41, 60-61, 80-81. So they found this particular phage or strain to be the most common. Most common in hospitals is which particular strain? 80/81. And obviously corresponding to that, the phages will also be there. That is the 80/81 phage will be the most common, which will eat up this particular growth. Simple. So actually the phage typing is a bit complicated one. You just remember up 23 types of phages are there, and 80/81 combination is the most common in most of the hospitals. If you remember this much also, that's fine. And we do it for what? For the pediatric nursery typing. We should do this regularly, because you need to know that what is the strain which is working up in my hospital, and is it acquiring the resistance of MRSA, or it is a simple strain, or what sort of thing it is, that you should know. Okay. So I suppose this particular thing is clear to you, that Phage typing is of 23 types of Phage typing is available, and 80/81 is the most commonly found in the hospitals. Okay. Now I will show you some pictures regarding the Staph aureus that will clean up the things in your mind regarding the various aspects. Okay. So guys, this you already know that this is the catalase test. In the starting only we have done that. The Staphylococcus is positive for this and Streptococcus is negative, and I know that in the starting I already told you 3% H2O2 you take. In that you add the colonies and this type of bubbles, they come in that particular one. So this is the catalase test. And after the catalase test, just now I told up the coagulase test. This is a slide coagulase test and this is a tube coagulase test. Now you should tell slide is for bound or free. The slide is for bound and tube is for free. Okay, tube free. This is the golden yellow colonies on nutrient agar, which I have told up non-diffusible pigment. Okay, and it looks more beautiful on what? Milk agar. Now, this is the testing which we have done for the quants, novobicin testing. If you are seeing this antibiotic is N and you are seeing this zone of inhibition, that means epidermidis is sensitive to the novobicin. And if you are seeing a small zone or no zone, then that is saprophyticus. That is the resistant form which you observe. Okay, so this is the novobicin testing, antibiotic sensitivity testing. Now, besides this, I like to show you the gram staining picture of Staph aureus. This is the typical gram staining, grape-like clusters. Just now we have done that. Okay. And this is that hemolysis which we talked about, the beta hemolysis. That is the complete zone of hemolysis. This is what is the beta hemolysis, which is observed in 5 to 10% sheep blood. Okay. And this is the selective media which we have talked about, mannitol salt agar. Mannitol salt agar is a pink one, changes to yellow. This also I told up. Then when it is positive for Staph aureus, going on this, it changes the media into what? Yellow. So this particular one are the various pictures of the Staph aureus which you need to remember. Okay. Besides that, one or two questions also I like to tell you that which sort of things might come nowadays. See this question. Okay, why I'm telling this particular question? Because nowadays, what they're asking, there are a lot of case scenarios based and all, what they try to ask up. So you should have an idea regarding this, that a 35-year-old man came to the OPD with the swelling of the hand. Okay. The patient has a history of skin abrasion on the hand while working in a garden. This much is clear. After 4 days, he noticed swelling and inflammation over the area of the abrasion. Okay. Followed by the swelling of the hand, a purulent discharge is coming from that swelling, was collected. Just now, we have done the lab diagnosis in the same way, sent to the microbiology lab. It was sent to where? It was sent to the microbiology lab for the gram staining and the culture sensitivity. The given picture shows the gram staining of the sample collected. On the basis of gram staining, what is the probable cause of the infection? So obviously, just now I shown you, this is grape-like clusters, and grape-like clusters is a feature of Staphylococcus aureus. It is a feature of what? Staphylococcus aureus. Besides that, try this question, guys, that the appropriate combination on the basis of the picture given. This is blood agar, enriched media, alpha hemolysis seen? No. Chocolate agar, enriched media, beta hemolysis? No. Blood agar, enrichment is liquid. Blood agar, enriched media. And this is which hemolysis? Beta hemolysis. The answer is like that they can also ask. By giving this picture, they can ask up regarding the appropriate media, appropriate hemolysis, and which type of media. So it's a solid media, enriched media, blood agar is there, and it shows up which hemolysis? Beta hemolysis. Is it fine? So this also is important. And we just want to revise up. Just now we have done. This is the best selective media for Staph aureus, mannitol salt agar. Okay, mannitol salt agar. And this is which test, guys? Just now we have done. This is the catalase test. It is which test? It is the catalase test with the 3% H2O2. Okay, and this one we already done. The slide is for the bound form and tube is for the free form of coagulase. And this is that golden yellow pigmentation which you have seen just now also. And this is that novobicin testing. Okay, so we have revised the whole thing with the help of images also. And as such also Staph aureus is full of questions. Okay, so thank you so much for this particular one.